And good morning. This is Professor Jennifer Harrison-Hauer. This is our HESI review, September 15th, 2023. Let's just dive right into it. We do have some guests. Let's be on our best behavior, people. And then this will be interactive because this is class. All right, let's get to it. All right, share my slides. Gotta move things around so I can see my notes. All right, you guys. Let me admit Miss Huff in. I threw this picture in because this is an example of a bathhouse way back when, and it screams public health. You've got everybody in there taking baths and showers, not changing the water. It's got children in there. Everybody looking like there's nothing wrong. Okay. It's frozen. All right. There we go. Got the right button. All right, you guys, diving into community health. This entire semester, it's been about the focus of your community. It's not med surgery in nature. Yeah, you may go out and do a blood sugar check here and there, but your entire mindset when you go into the HESI is your community. That is your patient, not your patient in room 302, but your entire community, whatever that community might be, whether you're working in a school or you're working as in a work setting, whether you're a church-based nurse, everybody in there. So it's a huge responsibility. But again, our tools are the interventions that we do, and we want to live in that primary, secondary prevention forever. We want to promote health. We want people to live long, healthy lives, free from disability, diseases, no diabetes, any of that perfect utopia. That is what our aim is. So everything that we do, our actions are usually in the primary and secondary realm, okay? Primary prevention of disease, assessing our community so we know what we're dealing with before we even go out there. And you guys did your vulnerable populations, your windshield surveys, we're case managing, but all in all, what we're always trying to do is keep our folks healthy, let them live long lives, good lives for as long as possible. And we have tools to do that, all right? But again, it is population based. It is not individually based, it is population based. So keep that in mind throughout the entire semester. You're not done yet. You gotta do one more huge hurdle, this HESI. All right. So again, our philosophy is our mindset. So you want to get this in your mindset going, and you should have had this in your mindset week 1 or 2, but it's okay. It's never too late. Is that it is everyone's birthright to live healthy and long lives. Doesn't matter where you're from, doesn't matter who you are, your community, everyone has the equal opportunity to live healthy and live long lives. So if your community or your group of homeless individuals, it doesn't matter, or the schools, it's the children in the school, it's the janitor in the school, it's in the principal, all right? It's everybody in your community, and that is your primary focus, okay? I don't know why I'm having computer issues. All right, so the idea of health promotion to begin with, again, is to give people the skills and tools that they need so that they make a behavioral change. And you can't change folks' behavior. You can write the most beautifulest care plans, Daryl, you're making me dizzy with all that movement. You know, I'm old. I'm just kidding. You're good. You're good. You just happen to be next to my picture today for some reason. I don't know why. But again, you're giving folks the tools they need to improve their own life, but it is their own life. I have, when I started as an LPN in 94, I used to see respiratory therapists go out and smoke. And I'm like, are you for real? You smoking and you can come back and suck somebody. So, but again, that's what you're doing is you can give them the information, but they have to make the behavioral change. They have to be motivated. And so how do you do that? But everything that you do is in partnership. But again, they have to make the behavioral change. Just like when I lecture, and I hope that people show me that they've learned through their results. I'm like, oh, click, click. Okay. We're going to dive into this prevention one last time. So here we go. Primary and secondary tertiary is it's intervention based. So it's actions. So what are you doing? And what does that look like? So our primary, no disease exists. So the action you're doing is preventing diseases from occurring, hopefully by giving people a flu shot, by talking to them about the dangers of smoking and teaching them about exercising, teaching them about what have you, because all you're doing, you're not going to reap the benefits of primary for weeks, months. If you give somebody a flu shot, hopefully they don't get the flu during that flu season, for example. But a lot of things you do, that's where, unfortunately, primary or any of this stuff, you don't see the results of, like tertiary, because somebody has something and you're able to blah, 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 blah. But again, preventing could be teaching that kid not to smoke, and years later, they still don't smoke. So it's intervention and action based, and primary, nothing, what you're doing, no one has anything, and you want to keep it that way. That's the bottom line for that one. And then secondary, go back. I'm a picture person, so go back later and look at everything. I threw in a bunch of different information. It's a hefty slide, but I'm picture oriented. I got to see and visual. So this is just another realm of your primary, secondary, and tertiary. So secondary, I think, still trips a lot of people up, because you're like, is it tertiary? You can slice secondary so many different ways. I tries to keep things simple. You can do the S's. Are they screening for something? Are they surveying something, like when they give you that clipboard in the doctor's office? All right. Surveillance. Just like when we did our camp nurse, what she noticed that, wait a minute, there's one too many kids coming in here with the runs. So that's the action that they're doing. All right. Somebody may have a lump that's and they detect it, but we're not saying they have it. It's the action that you're doing. So like with mammograms, it's early, their slang is early detection, early cure, but the action of doing the mammogram is a secondary screening. Okay. It is asymptomatic in nature. You can think of that word or what have you. Again, but if you remember the 3 S's and just keep it simple that way, that should help you. Okay. So then again, that one question on the exam about the TB screening, the TB, the PPD, it's PPD all day long as a screening. If you give me a PPD, I converted over in 96, I will pop up with a well, like 15. It will itch. I have not had a PPD. You cannot give me a PPD. When I was LPN, I worked with a lot of tuberculosis folks on our respiratory floor. So, but I do not have TB. But if you were to give me a PPD, it will be positive. But I do not have PPD. I do not have tuberculosis. So it's the action that's going on. Tertiary is easy for a lot of folks because that's what you're so used to, especially my LPNs, because if you're in the hospital, you got something, all right? And so, yeah, you can give somebody with a stroke a flu shot, but they have a stroke. So then you got to look and see if a disease exists, and you got to look at the action, sometimes both. Primary is easy because, again, they don't have anything. Folks get a little bit tripped up with their secondary, tertiary, all right? But we things are going to be clear. I think they've always been clear. They're not going to muddle up like, is it this or is it that? Is it this or is it that? Because with tertiary, they have an established condition, and then you want them to not have another stroke. So you're teaching them this. You're always going to teach and do support groups and what have. You want to, what do they say? One heart attack, your risk of getting a second heart attack, and all of these other things. So don't get tripped up on that. If they have an established condition, if they have asthma, they have asthma. They may not use their inhaler that much, but it is still asthma. So then again, a little bit about delving into tertiary again is that you have an established condition. You may, and again, if you're working with folks, if you're working with individuals, let's say a homeless shelter or what have you, you're concerned with managing the condition. You may have a group of diabetics. I will say, as community, I was a public health nurse on the reservation for 7 years before I became an NP. And so they had the highest rate of incidence and prevalence of type 2 diabetes. I think I mentioned that and what have you. So we would have groups of our diabetic folks. We would meet at the park. We would do this. We would do that. We would teach them this. We would teach them that, because the whole point is that we want them to not end up in dialysis. I think when I saw my first 20-something-year-old with renal disease and on dialysis, I thought I'd flip script. I'm like, are you for real? Back in the day, that was like 80-some-year-old people. So anyway, tertiary, that's your hospitals. That's your outpatient clinics. That is, you can have tertiary, of course, when you do your public and your community health, but that's usually where you see them, and you guys are familiar with that all day long. Go back and look at this slide here. This really kind of breaks down. This is the levels of prevention. This is the target population. These are different strategies that's involved. For secondary, for example, it's early case finding. When you have somebody that have syphilis, you're going out and you're offering them screenings for STIs and that sort of stuff. So go in. Now we're going to go again into like, how do we go about, this is all your community assessment, the next few slides. Okay. So data gathering, when you go out and you do your community assessment, it's your head to toe. I think I mentioned that several times. It's your head to toe. You need to know what you're dealing with. Just like when you have a patient on the floor, at some point, I always would do a quick assessment. I would do assessments throughout the whole shift, but I would at least eyeball people, make sure they were breathing, stuff like that. So you want to get the data, information so that you know what's the age of your residents, what's available for them, what resources are out there, how many kids, how many elders, what are their, what type of work are they involved in, all of those different things, because you're wanting to know what you're dealing with from the beginning. Okay. And then data collection. So there's data collection, data generating, data, but all of this is still under the umbrella of you doing your head to toe under your community. So with the data collection, okay, you're taking information that already exists. So maybe you're looking at, your local health department, and you're gathering information on, death rates, What are the number one causes of death in the community? Is it cardiovascular? Is it this or is it that? Again, this is all of you typing out, writing out what's going on, and then what you're going to do. Now you need to go talk to the people. Okay. And I know this data generation is small, but you can go look at it later. But anyway, data generation is a process identifying data that does not exist, but is developed through so now you got to go out and talk to people. You find out what their beliefs are. You find out who's the leadership, who's in charge. You find out what do they want. Because again, you can, when I did my community assessment, it was over months and months and months. And that's okay, because that's expected in a real community assessment. You're not going to do it over a weekend. You're not just going to ride around in your car. You need to gather this information, and you need to, you need to do your computer work, but you also need to go out and talk to folks. What you might think is an issue is not an issue for them. And so this is where you get your norms. What are their beliefs? What do they, because the whole point is that if you create something, especially let's just say with Native Americans, that might be disrespectful. You don't want to disrespect people's values and beliefs and social norms. People, my Native American tribe, they're one of the few that was not involved in the Trail of Tears, where they were forcibly relocated by the man. They actually have existed on the same land since time immortal. They have dinosaur bones and hieroglyphs and stuff. So you don't want to disrespect that. Know what you're dealing with. And then, environmental health. So what am I trying to say? With community and public health, there's a lot, and that's why it's specialized nursing. So again, if you keep in your mindset, somebody sent me a chat. Hold on, who wants to chat? You can. Oh, no, ma'am, I do not do copies of my PowerPoints. Thank you so very much, Miss Clarissa Matu from Orange Park. I wants to keep my job. Thank you. And welcome to all the guests. No, cannot, but you can watch, feel free to watch this over and 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 over again. Okay, so then when you think of the environment, of course, we know about air quality, we know about, water quality and what have you. But the environmental health is also things, exposures that you can have, not just at home. So that's great that we start there, but your community, are there, is there trash, and is there plants nearby? Is there poisonings? Yeah, you're like, well, I can't do anything about the plant. No, but what can we do? What can we do? I don't want to get into the specifics of it, but again, this is part of your assessment so that are there a lot of unintentional poisonings? Are there a lot of mercury in the fish or the stuff you can't solve everything, but you need to know every little piece of their life. And then at this level of your RN course, it's just the little tip of the iceberg. You just need to know that environmental health is an important part of your community assessment. You need to educate folks if they're smoking about the dangers of smoking. You need to screen them for whatever you need to screen for. That's environmental related. And you're not doing this by yourself. I used to have a whole Rolodex. People don't do the Rolodex anymore. But anyway, I would get folks from the county in. You're not doing all this by yourself. Just know that. There's folks that work in the environmental health department. I would call in favors. Look, I need you to come test this house for lead. I will buy you lunch. And then treatment and rehab if needed. So that's how the environmental primary, secondary, tertiary look at. Whatever question you get, know your preventions, and you won't get tripped up. You shouldn't get tripped up. And again, you can always teach folks the very, very, very basics, put this in the recycle bin, Try to reduce your consumption, this, that, and the other, reuse, everything that we taught. Those are, you can always leave people with basic information, okay? Oh, did you know there was a recycle place right around the corner from your house? Oh, yeah. I have to drive like 30 minutes, but you're so lucky that you have something 10 minutes down the line. Da, 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 da. I always want to be respectful because some people put everything in the trash, and that's fine. No, it's not fine, but always educate your people. All right, always educate your people. So when you're at the home, okay, so you're at the home, safety, they always taught us, and still teaching guys, safety, safety, safety first. You're gonna just, look around, take note. You don't want to sit there with your big old thing, start writing stuff down. Are they at risk for falls? Do they need assistance with their ADLs? And yeah, some of this may seem home healthy. That's not a word. Do not write that down. But again, it crosses over. Everything in nursing tends to cross over. If you're working in the hospital and you give somebody a flu shot, you're like, oh, I'm a public health nurse. Yes, thank you so much for giving them their flu shot, but you're still in the hospital. You may need to do different referrals. You work with different agencies. Look at folks' meds, look at everything. You want to, not judge, but again, you want to take note and inventory of their home environment. That's what this slide is all about. Now we're gonna get into, y'all remember our epidemiology stuff. So epidemiologists, that's part of your community health, okay? You will be, exposed to, if you go into this line of work, you will probably have 1 or 2 or 3 outbreaks in your life, and you need to be aware of ways that you can prevent this as much as you possibly can. So that disease occurs through a complex relationship. You got to have the agent, you got to have a host, you have to have the environment. And if you can somehow disrupt or improve these conditions, like improve the host immune status, making sure they're one of the first ones that get their flu shot, so they're not susceptible to the flu, making sure that they're eating healthy, all of these things. But so changes in one of these agents, I'm not agents, changes in one of these, the environment, the host, or the agent, okay, can influence the occurrence of disease by decreasing or increasing. So then, in order for disease to exist, these 3 things need to be in balance. So then you need to disrupt the balance however you can. And you can attack it from many different ways. All right. Y'all quiet. So again, how do we disrupt it, or we call it break the chain, so that the triangle is not nice and balanced? It's disrupted so we don't have disease. So intervention, again, those are the intervention. These are actions at the individual and the community level must be aimed. You gotta break the chain. All right. If folks don't ever get exposed to certain things, they cannot get certain things. So then that's why we love our vaccines, and you keep hearing vaccines, 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 because it's such a simple thing to do to try to keep people from getting disease. You might think, okay, what about the agent? Let me teach people how to properly cook their food so that they don't get salmonella, wash their vegetables, all of these different things. Stay home if you're sick, wear your mask, social distancing, all of those things that they were trying to do, during COVID, I ain't gonna get into all of this other stuff, is to disrupt the chain of infection. Again, you guys in my class have heard me say 50, 11 times, I still have friends that did not get COVID. My daughter brought it home from high school. She was trying to take me out. I took out my will. I'm just kidding. Punishment don't fit the crime. Fine. So your primary level of prevention, okay, that's your education, vaccine, secondary screening, folks, and screening. Y'all know about screenings, COVID screenings, and then again, tertiary, folks have an established condition. I think of tertiary, this is extreme tertiary, but the folks that end up in the hospital with COVID and intubation and all that, if that makes you feel better, not feel better, but to think, because then you'd be like, well, what they screened and they tested positive, then, but they still screened them. So it's still secondary. Don't complicate your life at this point in the game. All right. And then, so then they have the slide about immunizations, and we talked about immunizations throughout the course together. That is our number one weapon. Whether you're in the schools or church or what have you, you want to not only give folks, you know, vaccines that, the CDC, you want to know what's recommended. That's what I'm trying to say. Like, I'm at the age where I got the shingles vaccine. It was recommended for me. So, it's easy for people, children, oh, is your child up to date on his vaccines? The health department, this, that, and the other. But everyone 6 months and older per the Centers for Disease Control recommends people get a flu shot. So you're never going to stop recommending stuff. And people can say no, but you just document. If it wasn't documented, it wasn't done. So that if they get the flu, like if they do, they can't turn around and try to be like, you didn't tell me. All right. So just know that there are recommended immunizations for everyone. They have information included on the slide as far as prophylactic and preventative treatment. I'm not sure. I have not seen your HESI. I do not want to see your HESI. I'm not sure if you need to know about Tamiflu or Valenza, but just know that there are prophylactic and preventative stuff out there. All right. And then they have a slide here that this is what a allergic reaction, it doesn't have to be textbook, but you can have an allergic reaction, to anything. And this is an example of an allergic reaction to a vaccine. You can get a reaction in your 80s or when you're 8. So, and then this slide talks about VARS. I would just know that VARS stands for Vaccine Adverse Event Reporting System. This is a national surveillance, which is what? Somebody help me. Nobody wants to help me this morning?
Secondary.
Thank you. I don't know who you is, but God bless you. You're going to walk through the pearly gates. The rest of y'all have to stop. Okay, so yes, so this is an example of a secondary system, and it's on the national level. I've had to report reactions, different things to this surveillance system. Is, of course, if it's national, it's going to be in every, it's a database. It is not designed to say this vaccine costs this. You just need to report it. It's passive surveillance, you guys. We learned this in my class the other day. So it relies on people sending in reports, okay? Sending in reports. This is a perfect example of a passive surveillance system. And somebody behind some computer somewhere will be like, oh, this means, or possibly let me investigate. All right. And then they, a lot of this, again, these are slides that your school has placed. And so we just want to know the basics. You just want to memorize some things as far as these particular infectious diseases, the incubation time, the difference in date. Some of them are, I guess what I'm saying is that for me, if I were to look at this, I'm like, the flu, the incubation time is shorter compared to TB and what have you. So just know that there's different incubation times, whether you have to memorize it. I don't know. I would not think so, but just know that don't think that, oh, this person doesn't have TB or something, you always want to be vigilant, okay? And then they just talk about SARS that occurred, not occurred, it's probably been around forever, but it's a viral respiratory condition that was first detected in 2002, so it's been around for 20 years now. And then just go back and read this little blurb. This is information that you would want to know, that it's severe acute respiratory syndrome and that COVID-19 is part of that family. They all show up at the same family reunion. So that's probably why they placed that in there, that it, even though it occurred with 20 years ago, it's got cousins that are coming out that people don't know about at the family reunion. It's part of the SARS family. All right. And so the symptoms by now, we all have drilled into our brain. All right. Respiratory droplets is how it's transmitted. How do you break the chain? That's why they say wear a mask. If I don't get your droplets, I'm trying to break that chain. And then influenza A and B, by this point, it looks like we're doing our infectious stuff. So, okay, we're going to roll with it. Again, how I look at these slides is that they can all mimic each other as far as symptomology is concerned. I have had people that had COVID-19 and influenza B. So you're screening people. Secondary, primary, giving them their vaccines, wearing a mask, all of that stuff, whether they want to or not. You just educate people. You don't take it personal if they don't want the vaccine. You don't take it personal if they want a mask. Next year will be exactly 30 years I started nursing. I educated and I keep it moving. That's all you have to do. And let people make that behavior change if they so decide. But it is their life. What they want to do with their life is not your business. You just educate and do your job and move on. Okay. So, all right. And then an example of a positive, I want to say a positive PPD. Again, I'm not going to get the PPD. I think they do quantiferon these days, but anyway, it's in here. For me, I'm doing chest X-rays every so often. So just know that, again, screening, diagnosis, you're not diagnosing, but again, some people have screenings by the skin test, and then some people have to have the X-ray. But then this is where you're doing your due diligence and asking a question. Have you ever had a positive PPD? If folks look up you strange, the answer is no, because if you've ever had a positive PPD, it changes your life. So that will be a no. All right, they go into, now they're talking about vector-borne, mosquito-borne. These are all conditions that community and public health nurses will see. I have had Zika on the res. I've had some things, okay? That is a child born to a mother that was, that had Zika. And as you can see, you know, the children are affected by the condition. So then again, why is it important? Glad you asked. It's important because if you have risk factors for Zika, if you have had cases, then in my mind would be like, where are my pregnant women? Where are my women of childbearing age? I need to educate them. I need to try to make sure they have the preventative stuff. You know, again, how to, you know, focus on the mosquito. How do I make sure that that part of the triangle doesn't happen? Do I need to make sure that they don't have excess water laying around? All this stuff. I want to get into it. But again, mosquito-borne. Flu-like symptoms, again, you just, when you do your assessment, you don't know what it is, but it's your job to connect them to the right people, okay, and to keep people from getting breaking that chain. Dengue, it's a lot. Just go back later and just know the word and know that it is considered a mosquito-borne. I have had dengue on the reservation. I have had dengue. All right. And then Lyme disease is another tick-borne. So then again, what does all this mean to me is that you want to keep the ticks away. You need to educate people on how to check. So then you're like, don't get all like, oh my God, dengue, oh my God, Lyme. KISS for all of my nurses. KISS. Mosquitoes. Ticks. Prevent. Check. My dad and my mom used to do checks on us every night. Not every night, I don't say it like that, but check us for ticks, pull off ticks. We had dogs with ticks, and all of that. Prevent the ticks, the ticks, the ticks, the ticks. Don't worry about the Lyme. Worry about the ticks and the mosquitoes. You know, one of my best friends, she's Nigerian. We started out LPN back in '94. Her dad died of malaria. It's still a thing, especially if you go to other countries. All right, let me get that out. All right. Rocky Mountain spotted fever, I have had on the reservation. And I'm not saying this to be cute. I have had it on the reservation. And some tribes, especially in northern Arizona, my folks that are familiar with Arizona, the Apaches and the Apaches and up in the mountains, is endemic. Okay. So then they're always in prevention mode for Rocky Mountain spotted fever. They're always diligent. If somebody comes in with a history of a tick bite, fevers, they already go abdominal pain because it's so endemic in their area. They're already screening for that. It's a thing in the ER. One of my Apache friends told me. So then just know that it is another tick-borne. Keep it simple. Don't ask me to pronounce this. Ehrlichiosis is another tick-borne. Yes, wait for it. I have never seen this before. I would just know that it's a tick-borne illness. And that probably would be good. Knowing what the symptoms are, that's always a good thing too. Now, STIs, communicable disease, are mostly preventable. We talked about that. STIs, STDs, sexually transmitted infectious diseases, is still a huge concern everywhere. On the res, off the res, in New York City, in backwoods Alabama, it's still a thing. Okay. So you should always be vigilant and educate, and you want to live in primary and secondary. Okay. And just know that you want to start early as far as educating, respectfully talk to the parents, have you had that conversation sort of thing. Asymptomatic, a lot of these conditions, like your chlamydia, gonorrhea, may not show symptoms. So you really want to, if you have cases, beef up your screening and education. Serious complications, death, infertility, pelvic inflammatory disease. So you want to educate. I think I have drilled that to death. Especially since a lot of these guys don't show any symptoms, or the symptoms might be vague, or I have pain here in my pelvis, this, that, and the other for us ladies. Just keep that in mind. But delving deeper, this is your chapter 13. I wanted to go right back into community assessment, because we as community folks, public health folks, we are the perfect individuals to see the community as a client. You want to look at this particular slide and just be aware of, as far as a healthy community, we're looking at all of these different pieces, and you're taking these little pieces apart and you're delving in closely. That's why it takes weeks and months. And it's not something where people are expected you to have done in a month, okay? Because you've got a lot of different pieces of that pie that you need to look into as part of your community assessment. Then what we had to do, anytime with this, I work with another school, BSN community health folks, they have to do a community assessment and they have to present it. So we're at one of the homeless shelters. And so they have to drive around together. They have to do this, that, and the other. But they also, when they come up, they have to come up with a project, a community improvement project. And they have to present it. Because in my eyes, you don't want to go in and do all this stuff to community and not go back and tell them what you found. That's rude. It's like you're coming into my house and you're finding stuff, you're not going to tell me about it. So they have to, they're like, oh my God, we have to present in front of you. I'm like, yeah, you need to tell them what you found in their backyard. It'd be rude you coming out here and doing all this stuff and not tell them about it. Yeah, you can tell them. You can talk to them. You can rehearse. You can rehearse to me, but you need to. So they know. Some people may not know what's affecting them or want to know or know the severity of it. But anyway, these are all of the pieces of the pie that we want to evaluate because they're all part of making sure that our community is or helping to make sure that they're healthy. You're doing all of this in conjunction with the community as well. It may be one person. For example, when we're at the homeless shelter, they work with the director. They ask questions that they can't find online. Part of this, what is their spirituality, that sort of thing. Box, I have a little note here on my slide. So your chapter 13, box 13.3 is probably the best example succinctly if you just are pushed for time. Ashley, I want to go sleep too, but I can't. I got you. That if you push for time that you need to go, tell me about community assessment. Look at your box 13.3. That's your Christmas gift. You're welcome. Ecological map. All right. There may or may not be a question about that, but it is also a part of assessing the end. Now you're looking at households and families. So you do your assessment. And then if you're like I was assigned to a district, think of, I don't know, Mockingbird or Mockingjay, whatever that movie is. I don't know. And then I was assigned to villages. And then it gets kind of like that. So an ecological map, as simply as I can explain it, it's a visual diagram of somebody's relationships with other groups, with other organizations. So it's like a picture of what's important to them. So let's just say, since I see Ashley face, let's just say instead of Alice, it's Ashley. And Ashley is married to Ralph. And Kim is your friend, daughter, somebody. So these are all little pieces of the pie. If I'm trying to visually get an idea of what's important to Ashley, where she goes, where she has her. Oh, Ralph is your former drinking buddy. Okay. Kim is an RN, works but back trouble. So these are different pieces of your life that impacts you in some sort of way. If you want to do it on yourself, you can draw a circle here. Then underneath, these are the individuals that that impact your life, and then it breaks down some more and it breaks down some more. Have I done an ecological map? Maybe I have, and not this sort of way. But if you really want to looking at important relationships to this person, it's a visual, and you can show them. It's a visual map of what's important in their lives. So this gets a little bit more specific. But I would at least know that the ecological map is in a visual representation of your client's most important relationships with other people, with groups and organizations. That would be good to know. All right. And then, I don't know, the community health peds, saw a lot of lice. You got to know what impacts your target population, whether they're elderly, whether they're children. So then if you have, I had Head Starts in the beginning of the school year, they would request, and as needed, come in and check the entire group during orientation. They would have different things. So with community health peas, just know that they're, you know, they're people. They can have conditions as well that can impact others. You know, head lice that spreads through the school is never good. You want to do your basic hygiene teaching, start them young. They may have to be, you know, retaught how to like properly wash their hands, and just know that. And then again, with your school nursing as well, you're always going to, this is your community, like I talked about earlier. They have conditions as well that you may, you know, infectious diseases that may occur. So always keep that in your mind. Always look at it from a primary, secondary standpoint. In my class, when I showed that video, she had somebody with a feeding pump, and then she was doing primary. She was switching up, checking vision screenings, screening secondary, primary teaching and education. So no, again, it's still your community. It's just your title is school nurse. All right. So why is this slide here? Not sure why, but it's good to know. Let me spin this. Acanthosis nigricans. That's not what it is. Have I seen it? A lot of times, because again, on my reservation, we have a lot of diabetes. So this particular skin condition is associated with obesity and insulin resistance, which is your precursor for diabetes. So then you want to pounce on that. You want to go ahead and do your education and teaching. You want to do your screenings, your BMIs. You want to do all of that sort of thing. So if you were to see that, then you know that they're at risk for diabetes. And you may see this in your pediatric population as well. You can see it at any age. So just know that. All right. It looks like a dark, velvety, thick patch. And it's usually I see it on the neck. You know, I'm not looking at people's armpits necessarily, but I do see a lot on the neck. And then they don't even realize that they're thinking there's something wrong with their skin. And that is actually, well, it's a condition, but it's associated with all of that. In teens, you know, they're invincible. They think they're going to live forever. Okay. And then we know that they have conditions as well. And these are the ones that tend to affect your teens. All righty. So just be aware of those. You want to do your, again, safety. You want to teach them about seat belts. You want to teach them about, you know, the dangers of drinking and driving. If any of you guys have teens or teens in your life, you already are understanding the impact of that as well. And then again, this you when you're working with teens, think preteens too. I would usually start like middle school, when I would go out to the middle school and really delve into alcohol and drug and tobacco. I'm finding that sometimes I have to back up to 4th and 5th grade, you know, it's starting to be an earlier conversation, but it's never too early to have that conversation with your teens about safety and the dangers of tobacco and different vaping and different things. Just have that conversation with them. School is the best place. Again, they're not around their parents. They usually speak to you more freely when they're around their peers. So that's a good opportunity that we found as community nurses. So then safety for this particular group. Well, all groups, but for teens as well, because they have that invincible mindset, if you've ever dealt with teens. And then your adolescents and your young adults. So we're moving along here. They're just at a very, I don't know, they're not adults. They think they are. They're still growing and developing, so they need to know that things that they're doing can still impact their health, their growth, their developing. they get to a certain age, in high school, they're like, I'm an adult. No, you're still growing. Your bones are still growing. So the things that you're doing can still impact your life, your development. So just know that as well. I usually try to bring out for the teens, I would bring out examples, real life examples, not to scare them, but put it to so where they can understand. All right. So if you're assigned to a geriatric population, I remember um, we would do it. Oh my gosh, we were from Head Start one week, and then we would go out to the elder communities as well. One of the things I appreciated about the natives is their respect and love for their elders. So they would make sure that they in every community had their villages, and so it was like sub, but they would take meals out, and then they had these little small community buildings where they would gather the elders that wanted to, and they would have different games and events. So I would come in and do blood pressure screenings. I would come in and do their flu shots. But again, this is just a slide that shows you that, that conditions that they can have and to be aware of. Usually you're dealing with a lot more tertiary, which means you're trying to prevent complications and amputations and that sort of thing. But you don't give up on them because they're the elders. You want to just make sure that you're aware of the conditions for this particular, whatever group you're working with. Staying hydrated, they do exercise in their chairs, all that sort of thing. You're gonna know you definitely are going to have to work with your community resources as well. I did a lot more referrals for home health. I did a lot more social work referrals, nutrition referrals. You're gonna have conversations. There's such a thing as elder abuse and what have you. That a lot of referrals for Meals on Wheels, that sort of thing. And then this is going to be super quick. Always, not all, you always want to focus on nutrition. Not going to delve into too much, but how nutritional deficits can affect us and people. I've done screenings on 19-year-olds and their vitamin D is severely low. I'm like, do you go outside? Wake up, Ashley. Wake up, Ashley. Do you go outside? Do you eat your vegetables? You could teach anybody about the food guide pyramid. I don't even know if they do the food guide pyramid anymore. They used to. Nutrition can impact us at any age. And so that's for me, nutrition. Okay, I should have been an RD. Nutrition is something that's easy and basic and simple. I made sure my mom's got on WIC. If I would go out there and they had a 3-year-old, after, like, people know WIC when they were pregnant and have babies, but afterwards, just like you get busy being a mom and you forget. I'm like, you can still be on WIC until this child is 5. Really? I forgot that. I'm getting healthy food into the house. Okay. And then your community health, your community case managers. Case managing can occur in any setting, but as far as our community folks, I would case manage like my high risk teen moms. I would make sure that they get coordinated with all of the teen parenting programs, the different programs as well. You're going to be working with a lot of different providers. Usually what the case manager does is that she's case managing different aspects of that person's condition. So it tends to be it tends to be more tertiary in level, but just don't think of it as that. Just think of it as care coordination. You're working with a physical therapist if they have the rehab, dietitians if they have the diabetes. You're working with whatever different entities are needed to manage that person's condition. And so Are they getting the home equipment? It's a lot of follow-up and checking and connecting so that that person is not spending time on the phone trying to get all of this done and getting frustrated and getting lost to follow up. That's what you're helping to do. You're helping them and working with them. So you're that person in the middle there. All right. And you're staying in touch with your clients and what have you, but you're doing all the legwork and you're doing all the follow-up and you're making sure that they get everything they need so they can live happy and healthy lives. All right. Now we're going into our faith-based nursing. Okay, your holistic spiritual nursing. Hospice is an example. End-of-life care with dignity and comfort during the dying process. Okay. You're not curing. They should know that when they're entering in as respectfully as possible. I have mentioned, the different family dynamics that usually come about during this time. Feelings come out. Be prepared for that. You're assisting the peaceful transition. And then you are making sure there's communication between family members, making sure that that person's needs are met. You're making sure that you're there to explain different stages that are going on with that person's body as they're going through different parts of the dying process. Okay. And then again, we are also involved in disasters, natural disasters, man-made disasters. In Arizona, monsoon season and flooding is huge. So we're making sure folks are prepared. They have food, they have sandbags, they know not to take this route. You need to take that route because this particular area tends to flood. Most people know what area to stay on. What is that? Don't drive through this. There's a law. Forget the name of the law. Something motorist. No, I know. Stay away from rushing bodies of water. Don't think you can drive through it. I don't care what kind of high. I don't care how high your truck is. Don't do it. Okay.
Especially
And
where
then
you
this is
live.
an example of the disaster triage system. I wouldn't try to memorize, but usually like when there's a true disaster going on, folks have to be tagged. There's a color system. There's usually there is a nurses involved in the triaging folks, examining patients, sorting them out, who goes here, who goes there. Usually this occurs during like mass casualties and that sort of thing. But there is some type of system to where, someone can come quickly through and see red is immediate. They have a chest wound, they have fractures, that sort of thing. You got to use your critical thinking, your triaging skills. This is where your med surg can definitely shine. But this is a way to make sure that the people get the services they need as quickly as possible. If you have someone that's deceased or expectant and you quickly scan and see that that black tag, you can just move on to find your reds. All right. And then we talked about our migrant workers and the different things that they are subjected to, the repetitive motion, the musculoskeletal system. You want to keep that in track as well. They're working 12, 14 hours a day. That will take a toll on anybody, but especially they really harped upon the musculoskeletal system. So you want to remember that. The back and the neck and the most common types of chronic ailments was reported: low back pain, sciatica pain. And all of this may seem, again, med surgery, but you never leave that med surg at home. You're always going to take that with you wherever you go. All right. So you want to do things, again, education, provide primary, secondary prevention, that sort of thing. keep people in primary and secondary. It's where if it's a migrant, if it's on the reservation, if it's in a school, this is no different. How are they bending? How are they lifting? How are they picking up? Because they're going to definitely be bending and lifting. And so do they have the supportive equipment that they need? Um, and that sort of thing. And so again, just a little bit more about the migrant workers, their decrease in leisure activities. Well, it's hard to do that when you're working all the time and then you're tired and you're sleeping. Um, again, they're caring for everything else but themselves. So you just, again, you want to look at the gaps and where you can put in your intervention levels as well. That means if they're working all the time, how are they going to the doctor? Maybe you want to set up a mobile clinic. I'm not going to get into specifics, but again, this is all just knowing that if you've been working with migrant folks, knowing what you're going to be coming into, and you still need to help them live happy, healthy lives, even if they're working 24/7. You can do it. And then substance abuse. Substance abuse in adults, teens, and older population. Oh, just substance abuse. I'm seeing it younger and younger and younger, younger and younger and younger. All right. Addiction is a pattern of abuse. You're preoccupied with trying to get that particular drug. High relapse if that drug is removed. So addiction is a established condition. It is tertiary. All day, every day. I've said on I think a previous review, just if you guys ever watched Euphoria, just keep her in your mind if you have an addiction question, and you should do just fine. You cannot primary her, you cannot secondary her. It is tertiary. And you're trying to keep her, I'm like, one more time, and she is not going to wake up. And that would not be living a happy and healthy life now, would it? But she's got to do the work. She's got to do the work. So then there's different type of drugs. Caffeine can be abused. Energy drinks. Let's just keep it a little bit more simple. Euphoria. I can only do like a couple episodes, and I'm like, no, I gotta watch something happy. but anyway, so even energy drinks. So like when I would see my moms come in, my pregnant moms with a red book, I'm like, put that down. You're giving this child all this, giving this child palpitations. Right. Okay. So delving in closer again, I like this particular, again, I'm a visual person. Go back and look at it again, the intersection of prevention and harm reduction efforts, how it relates to substance abuse. So then primary is you're preventing the initial use. The girl on Euphoria, never, it was just a dream. The whole show was just a dream. She never even began to use drugs because I taught her and educated her, and I prevented it at the primary level. Secondary is, again, it's early detection of or reducing a substance use once the problem has already begun. All righty. So then early detection means you're identifying that she has a possible addiction. She has an issue. You found this, that, or the other under her bed, or whatever. So you're identifying, all right? Early identifying for early intervention. So the use of a survey, and she goes to the doctor's office in the past week, how many times have you used drugs? She should be like, every day. Red flag, red flag, red flag, red flag. So then you're identifying those individuals, all right? So let's say drug education in elementary school is primary prevention. Secondaries, let's say your S's, you're keeping it simple. You may find something, okay, but the action you're doing is secondary. And then keep her in mind for your tertiary. How many times has she been in and out in a rehab? How many times has she been in counseling for addicts and lied? Those are the things you want to keep in mind. All right, we got to get through this. And then again about mental health is heavy. You know, you're responding to the feelings expressed by a client. You're listening to them. You're allowing them to express themselves. There's different types of communication techniques that you can use with anyone. A lot of times when clients come in, I can tell they're angry. I had to wait 3 weeks to see. I just let them talk, just get it out. Just get it out. I just listen. I'm not going to change the subject. I'm not going to be defensive because I know it's hard to get into safety. I'm not going to stereotype. You want to stay on that left side. Occasional nods here and there, sort of thing. Especially, I don't want to say especially with mental health, but you don't want to set folks off. So listen to them without judgment. And then abuse. Teens are more likely to experience violence during their pregnancies than adult women. Age may be a factor as far as abuse is concerned. I wouldn't try to memorize that, but I would just say that abuse can look like many different things. Just because people are married or partnered don't assume that. I assume nothing at all. Elder abuse can occur. You would be like, why would they be to grandma? It's not necessarily physical. It could be mental. It could be so many. It can look like mental abuse. It could be a lack of giving, lack of giving her the care that she need. I want to say purposely, but leaving her in her diaper, or excuse me, depends all day. And like, she's okay. She doesn't pee that much. Substance abuse, poor compliance with prenatal care, all of those things again can lead to poor birth outcomes with abuse in teens. I just want to cover that. Young women may be protective of their partners. Men may be protective of their partners because there's same-sex abuse that can occur. Abuse can occur. It has no bias as far as anything is concerned. So don't just assume. You want to know. Folks are, you see this bruise, they're defensive, they're fearful. You just want to you want to listen, you want to make note, you want to take a history. You want to do frequent routine checks and assessments. It could be a phone call. It's more revealing if you do frequent assessments than just a single initial visit. So you want to keep an eye on that person. Violence that occurs has occurred oftentimes for months, weeks, and years before you show up. You want to acknowledge them. Again, acknowledge your feelings. Don't judge the guy, because she's going to defend the guy, and get them the help that they need if they're ready. And then you're homeless, switching over to the homeless. They have the same challenges as those in poverty, except they don't have a home. And I mentioned before that, especially with homelessness, if homelessness and poverty, that's a double concern, because if you have a home, but you're poor, at least you have a home. But if you're homeless and you're in poverty, that's just a lot. And so again, if you ever are working with, I have done some community stuff with homeless folks, and then with my my other group or what have you, that there's your community resources. All right, know that their health care is ER, because they don't have transportation or insurance or all those other things that we take for granted. And then families with children are the fastest growing homeless population. That is something I would know. And again, just talking a little bit more about homelessness. Cause usually is not usually caused by, but sometimes there's a mental health component. Sometimes it's health related, addictions, other serious conditions, not just I didn't pay my rent. Well, that could happen. You could be temporarily homeless if you don't do that. Homeless persons face higher rates of poor health outcomes because all of those barriers to getting them to care. They may experience understandably stress and malnutrition because they're not getting all of that. So then knowing this going in, you want to connect with your partners. There are organizations and groups in most areas that work with individuals, and you just have to, sometimes you're that person in the middle to get individuals connected. Like one of the places where we do our clinicals, the Gospel Rescue Mission here in Tucson, they go out to I don't want to say the most known homeless camps, the huge camps that we have. They have a rotating calendar, but not everybody's at those camps. And so anyway, just connecting individuals. You're not trying to solve the world as a community public health nurse. All right, just know that. And it can be a heavy job, but you are not doing this by yourself. And then if you're working with, this is a little bit about cultural congruent care, culturally sensitive care. Our world is a melting pot. The US is a melting pot. You're going to come across individuals who look different than you, who may speak a different language. That's fine. I have a short little joke. It'll be really quick. What do you call someone that speaks many languages? Polyglot. What do you call someone that speaks 2 languages? Bilingual. You call somebody that speaks 1 language? American. And it's recorded because the Native Americans I work with, they speak their dialect, they speak English, they speak that and what have you. So you want to know that you want to know different value systems, even foods. You not put pork on some people's plate, faith-based, just what can you do? Educate yourself on what's important and be culturally sensitive and respectful, just like your mama and daddy taught you. Native Americans, okay. Some folks did not get this correct on the last exam. It was on my review. They are past oriented. They are not concerned with the future. What does that mean? What that means is you're instructing the client to call in 3 weeks for a follow-up appointment. It's an action that is future oriented. So what do? You may have to schedule that appointment for them. You call them up, you let them know, and then you call them up the day of the appointment. It's to get them there. All right. So even if you schedule the appointment, and I know that's a lot, but that's what we have MAs and stuff for. If they don't show up, it's not because they're being rude, but it's not every single person, but just knowing that they are past oriented, they're not concerned with future appointments. So you have to get to know you people. I already know you need to call her in the morning, make sure she's got a ride to get in, because I know she's forgotten about this. And they get letters, they get phone calls. Keep it simple. They are not past, they are often past oriented, not future oriented. They're not worried about that 6-month appointment. I don't know if you guys have ever had appointments where people schedule for you like months in advance. I have a calendar, I have my phone, I have 2 different systems, and I show up early. I'm on time, which is early. Not every culture or not everybody is like that. So just know, if you're working with Native Americans, that they're past oriented. Just know that. And if they don't show up, next time okay, this is what we're going to do. I'm going to make this appointment for you. I'm going to have my MA call you in the morning before your 3 o'clock appointment. I've arranged transportation for you. Okay, I'll be here. Call him. Oh, yeah. It's today, right? Mm-hmm. It's today. Oh, okay. I'll be there. And they show up usually. But you just gotta know what you're dealing with. And that concludes our HESI review. You are ready for the exam. You have studied. You know what you need to go back and focus on. And you will do just fine. Because you are resilient. And with that, you guys, I am going to conclude our HESI review. And hang on, I know how to do this.